people shouldn't trust their doctors. I don't trust my doctors. I wouldn't trust one person or a group of people as my only source for medicine, especially when the menu and their skills are limited.
Hello, and welcome to Awake at the Wheel. So in today's episode, we have our guest, Dr. Maggie Yu. She is a family practice and certified functional medicine physician who graduated from UCLA School of Medicine and has been practicing for 25 years, over 25 years, in fact. So Dr. Maggie, thank you so much for being with us. And before we jump in and talk a little bit more about you and your practice and your work, I just want to express how excited I am and how excited we are to have this conversation with you, because so much of your work overlaps with the work that we do in our clinical practices, working with individuals, of course, who have mental health concerns, but the overlap with chronic pain, chronic health issues, and so on. So after expressing that excitement, just want to say welcome and thank you for being with us.
I am very excited to be here, and I'm looking forward and wanting to be surprised with some of these questions.
Well, you're in the right place then.
I love it.
All right. So, Dr. Maggie, why don't you tell us a little bit first about what inspired you to begin looking at the whole body? Because as we know, that does differ oftentimes in the traditional healthcare system. So what was the starting point for you with this?
Yeah, the starting point is my own illness and my own inability to find my own answers. And it's my own hitting rock bottom. And to me, that journey was punctuated at certain times in my life with, I think, the delivery of my first child, followed by later, a couple of years later, the delivery of my second child. And then finally, with my early menopause at the age of 36. These postpartum events, turns out in the end, not by accident, turns out in the end was a pattern, turned out to be, in the end, a pattern that's missed by conventional medicine and missed by all the training and practice that I had done up to all those points. So I would say that it's that dramatic health decline into mystery symptoms, feeling like unicorn illnesses, that had a major impact on my health, including, I had postpartum depression, fibromyalgia, chronic pain, TMJ, severe depression, anxiety, diagnosed with ADD as in my mid 30s and put on Adderall, all of which turned out in the end to be really stimulated by underlying autoimmune disease. As well as other root causes that now we know had its infancy in my genetics and in my environment, and in my own work stressors and life stressors throughout life. So I would say that in overcoming my own illnesses and having to come out of the box to find my own solutions is where this all started, because I had nowhere else to go but up.
So as a physician, how did that experience change your perspective? Because, and speaking only from our experiences and mine specifically with clients that I work with, oftentimes there is a great deal of frustration and hopelessness and just lack of feeling understood by their physicians when they're experiencing these mystery illnesses and symptoms and things that don't have a clear explanation. So how did that change your perspective as a physician?
Well, I would say that, my first 10 years was as a family practitioner. And what happens in the break room, people don't really realize up front. What happens in the break room is that every single day, those of us who were practicing and delivering family medicine care, we're designed and we're trained to deal with the ability to diagnose and treat at least 90% or more of whatever symptom comes our way. And then the other 10%, we're supposed to refer out to the right people, right? We're sifter and sorters, but on the front end, we should be able to deal with 90%. And increasingly, there was a population of people who were tired and sick and tired of being sick and tired. And predominantly, they were women, and not exclusively though, but women in their mid 30s to mid 50s that were sick and tired of being sick and tired with all normal labs. And who are coming to me and asking me things like, what do you think of this diet? What do you think of this supplement? What do you think of this hormone test? And I remember, and this is super clear, my biggest shame as a physician looking back is telling every single one of those women that, number one, their labs were normal and that there was nothing that I could do for them, except maybe They need to go seek marital therapy or individual therapy, get them on an antidepressant, right? Or lose weight and exercise more, right? That's what we were told to say when all these literally cursory labs were normal. And when I look back, I'm horrified. I'm horrified because, and I had women and men and parents desperately coming to me to say, hey, what do you think of this supplement? What do you think of this dietary change? And my trained response was, there's no data for that. But I found it helpful. You do you. If you found it helpful, you do, but there's no data around it. I had never looked at the data a day in my life because I'd never received any training in that in my life. And so why are we saying this to people? So my biggest shame is that in our own ignorance, in our own training, we lied to people, or we were dishonest, or we gave people half truths. And so it really shaped my practice when I became that patient, when I became that parent. I realized that is an absolutely unacceptable answer or set of answers. And I will, at this point, even say that I think it's medical gaslighting, even though we didn't know as physicians that we were participating in that.
Yeah, so on this podcast, Oren and I often talk about good intentions executed poorly. So I think this is certainly one of those situations. I would hope that there is nothing, purposefully malicious about that, but it's so disappointing to hear that people do. And I hear that term so often with the clients that I work with, where they feel that they're gaslit because later on down the road, after years and years of exploration, they're like, I was right. I was onto something. X, Y, and Z was actually happening.
Let me give you an example. When I was 36 years old, I went into no periods for a year, and my FSH, which we know is a blood test to diagnose if someone's ovaries are really shut down, like postmenopausal, came back in the 80s. Which by all account, it is medical menopause, right? And I remember talking to, and these are my colleagues, right? I went to my gynecologist, a male colleague, and I said, hey, why is this happening? Like, I'm 36 years old. I'm not 86. And the response was, hey, Maggie, you're just getting older. And that is an unacceptable response to be given to a 36-year-old woman, I promise you, in any way, or even a physician at that point, right? And in hindsight, and this is really interesting, and I love talking hormones, and there's a huge hormonal component to everything. And one of the things I learned years later was, how many years? 2-3 years later was, I had an underlying autoimmune disorder called Hashimoto's, which is an autoimmune attack against my thyroid, which, by the way, is a hormone-making organ. And then still to this day, nobody understands or talks about this concept, is that if your immune system is accidentally mistaking your thyroid, which is a hormone-making cell, as a germ, what do you guys think is the likelihood that my ovary cells or adrenal cells or brain hormone cells are also, they make hormones. They look very similar to thyroid cells. What's the likelihood they're also the target of an autoimmune attack and that they're being attacked, right? And we have no test to diagnose that, but we see hormones that are dead in a 36-year-old and we're not even asking why, right? So once I discovered the Hashimoto's and I figured out through developing my own protocol really to save my own life, how I can actually stop the autoimmune attack, my thyroid hormone function improved. And guess what? My ovarian hormones and adrenal hormones came back online. I came out of menopause at the age of 38.
Wow.
And I didn't go back into menopause until I was the age of 49. And this time really gracefully. Thank you very much.
Amazing.
But that's not out of ignorance or bad intent of my colleagues. This was what they knew, the best that they knew how was to do an FSH. And if you weren't making those hormones, right, you're in menopause. That is a correct medical definition with the best intent, with the best that they knew how, but it was wrong.
Yeah. So your protocol, the Transform protocol, can you tell us a bit about that?
Absolutely. And for me, it was really interesting. It was foraying into my own journey. And I remember this was like, believe it or not, when I went to early menopause, it was when Oprah and Suzanne Summers Oprah interviewed Suzanne Summers, and she was talking about, and Suzanne had written a book about hormones, and people thought they were insane. And I remember being in, I think they even were on a cover of a Time magazine or one of the major magazine covers. And it was about people talking about hormones and being insane. And yet, when I look back, that was the beginning because people started to question what we were told about menopause or about hormones. People started to question, well, should people be taking hormones? What are bioidentical hormones, natural versus synthetic? And it just kind of started to snowball from there. I started to learn about bioidentical hormones and by literally, because there were no normal avenues for an MD or a medical professional to learn about what bioidentical hormones are, I called my compounding pharmacy, which was local. I read some books and I said, hey, you're a compounding pharmacist. Help me understand this. I was taught by compounding pharmacists who were really kind enough to actually teach me about, oh, you need to test hormones. And yeah, you need to, there's all these other ways to test it. Here's the thing. I started developing a reputation being one of the only medical doctors in Portland, Oregon that knew anything about how to test hormones, how to prescribe bioidentical hormones, anything about it. And my family practice started to blow up with patients coming from all around the area because there wasn't an MD. Right. And so later on, when I started my own practice, about 2 or 3 years later, the entire practice was filled immediately with tons of hormone patients. But here's the interesting thing. Giving hormones may temporarily help a lot of people. But there's a huge population of people where if you give them bioidentical hormones, they temporarily improve and then they get worse. And is constantly, just like thyroid patients, escalating up and down all the time. And I started to realize as I started my own journey to understand why I wasn't responding the same to hormones either, was that there was an underlying autoimmune issue. Once I discovered mine, I started questioning in my patients, men, women, and children, to say, oh, was there an underlying mechanism causing their hormones and not where it makes it so that just giving them some hormones that, maybe 30, 40% of the other population did just fine with. Why was this 50, 60% not responding is underlying autoimmune attack. So I started to test. I started to think, well, what has helped me turn around my autoimmunity? I started thinking about the role of gluten in food, right? I started thinking about what are ways that we can test that, because that was huge for me, right? And accurately test that. Found out that was a crazy landscape of bad labs, bad data, bad training for docs, right? And so I discovered there were layers, right, in my own healing. And then I started thinking how I can roll that out with patients. And it came to really testing and understanding what hormone balance is. And it may or may not include bioidentical hormones, usually does not. Number one. Number two, think about the underlying, why are people having these hormonal fluctuations? And I thought food absolutely related with it. So food sensitivities, but also the kitchen the food is coming into, which is your digestion. When we talk about COVID, when we talk about some of these mental health issues, I would love for people to understand, I am Dr. Digestion. Really am. Digestion is a huge genetic thing that we are born with, that as life and other things come on top of it, compounds it. I have not met someone with chronic pain, mental health issues, POTS, that didn't have an underlying digestion issue in the first place. So that's huge. And then thinking about, as a result of poor digestion, then we get into vitamin, mineral, nutritional deficiencies that people really get into that are fueling all these mental health and physical health symptoms. So it's called the 5 pillars protocol that I have, and it goes through all of these in a lot of depth and detail. But those are the real root cause, no matter what the chronic disease is or what the mental health disorder is.
So I know Dr. Amate has a bunch of questions too, but I'll ask one question around that and then turn it over to you. Oh gosh, I have so many questions about the protocol.
Hit me. I love it. Come on.
So I know here in Canada, the excuse, let me backtrack first. First and foremost, I have the utmost respect for physicians. I know how much training and devotion to their patients they have. And, I don't want to discount that. But here in Canada, oftentimes the excuse for why that in-depth protocol or method of looking at illness is not taken is because, well, they just don't have the time. With our healthcare system, we get a 10-minute doctor's appointment if we're lucky. And in my own experience and in my clients' experience, when they bring forward, maybe novel ideas or theories or whatever the case may be, it's shut down. here's your pills, see you later, get out of here.
Warehouse medicine, we call it here in the US. Yes.
Okay. So that answers my question that it seems to be similar in the US as well then.
Well, because how are we compensating providers, right? When you follow the money, you know the exact type of care you'll be delivered. Right? Because the compensation model of that provider, of that health care system will define your care. So you are not going into a full menu. You're going to the menu that is going to feed the whole financial structure of compensation. So in a insurance-based practice, in a government-paid social medicine practice, providers, interestingly, in an insurance base in the U.S., it'll be by volume. The more number of people you see, the more number of procedures you see, the higher your level of compensation. In a socialized medicine, there really actually isn't a volume, right? You might be measured by the volume, but it sounds to me like it's more like, let's get through the hours in the day to see, and you're going to be pressured to see as many people as possible because you're in a sense, an hourly wage worker in a socialized medicine in a lot of ways. Am I wrong? Am I right? Because we have a lot of Canadian physicians and clients in my world. Did I get that right?
Seems like I think so. Like that's why they will triple book patients. That's why people are waiting for so long.
Squeeze the hourly worker. Right. So that's the compensation system. So what I found was that if you're participating in that system, expect that for your menu that you have, which is whatever's going to get you out of the doctor's office as quickly as possible is what you're going to get because that doctor or that nurse practitioner is trying to survive. Okay. In an insurance model, just so you know, is it's going to be 5 or 10 minutes. And yes, there's 10 minutes additional you don't even see in charting the documentation the provider has to do, but they're still squeezed. Both of these systems inherently is to squeeze as much volume as possible, which means you're right. There is no time. There is no time. And it's not the provider's fault. It's the compensation system with which they work in that you're participating in. Okay. That being said, I realized had I continued to be a doctor in that setting and a recipient of that care, I would be dead 3 times over.
Okay. So given how the system operates, I'm wondering who, if you can quantify it, who gives you more pushback? Your colleagues who don't want to, change their own system or, the different, let's say, systems that are funding the different organizations, that are funding the entire system, or are you being received with open arms? Are people saying, "Wow, a whole new approach to medicine or to health"?
Yeah, so that's really cool that you asked that question because I'm 27 years in practice right now, and when I went into family medicine, into functional medicine, that was a switch. And what happened was, insurance didn't know what to do with providers like us in the U.S. So initially, they were allowing us to bill as regular medical visits, which they were. They were just longer in time, more in depth. So they were at a higher compensation level because there was time blocking for billing, right? And then about, I would say in my private practice, which ran about almost 10 years, about 7 or 8 years into it, insurance then suddenly decided, we don't want to compensate the same. Right. And in fact, we're going to go back and try to get all these doctors and we're going to go back 3 years and we're going to try to sue you for testing that now we deem, unnecessary or services that we now deem unnecessary. And it frankly put a lot of people out of business and scared the crap out of all of us.
Wow.
And so for me, that initially was definitely a thing from insurance. And then because being one of the first in Portland, I had to switch compensation model, right? I had to say, well, either I stop providing this care in the insurance model, or I have to stop accepting insurance to be able to continue to provide this care. And I was in a smaller suburb of Portland and not in Portland itself. And I don't know if I can say this. No, I'll be totally honest and I'll say this. Once I switched my compensation model, it became the Salem witch hunt from the community because we were the family medicine practice in a community that serves 12,000 people and, 8 providers, 12,000 people. There were other primary care clinics in the area, but we were half straddling that line. And when that insurance happened and I had to switch, it became the Salem witch hunt in the community towards me personally. Because people were just like, we shouldn't have to pay for healthcare. How dare you not take insurance? And meanwhile, I was being sued by insurance companies for 3 years of care that we already provided that we can't get back from anyone else. And so I had no choice And so eventually, so that's what actually pushed me to get out of clinical medicine altogether on one-on-one clinical medicine, was that there was so much at that time misunderstanding around doctors who went into concierge medicine, cash pay practices, right, or online business models in order to survive. That I, honestly, on a whim, I was like, you know what if I created a online program that actually were able to teach patients the 5 pillars while providing them care? Would that work? And I did it as an experiment. And within I was thinking about, if I could just make like a side hustle to balance out what was bleeding out at the clinic because of what was going on, I would be able to survive and I could fund the continuation of this clinic. And within I would say the first month, 2 months, it exceeded my expectation. And within the first 4 months, I realized I got bigger outcomes. Bigger, faster, more permanent outcomes by doing this on an online setting. And also by just not even dealing with insurance, just coming straight out and saying, this is what we do. These are the outcomes we provide. This is what it costs. And insurance won't cover it. I wanted to see what the market would do. And they came in droves. And within 6 months, I had so many clients coming in from all around the world, reaching out for this information, this service. I closed my clinic. I broke my lease and closed my clinic. It was, the insurance model and the small town mentality at that time really forced me, honestly, out of clinical medicine. And yet, when I broadened the scope in the world and said, hey, this is what I do, these are the solutions, people realized that they couldn't get this anywhere else. My online practice, and I didn't have a traditional online practice. It's programs. We educate people. We work with people in groups. We also have one-on-one services as well. But there's all these different ways which we can meet people where they're at. But what I found was an educational model was actually the way out of this, not a one-on-one clinical model. So I've been very clear when you look at my 8 years of online content that I've developed, I'm here as an online educator. And what we do is way taller order than just, here's green medicine. Here's a supplement for this problem. Here's this one test. Here's this one supplement for that problem. I teach skills. I teach normal individuals and I teach practitioners the skills with which they can troubleshoot and manage and think through all the way I think. And so that's a much taller order than, one-on-one telemedicine, which is not, what I'm doing. So for me, the market really dictated it. And I had to move away from insurance compensation or any sort of government type compensation in order to do the work that I do, because even within the population itself, there's a lot of small town America and taboo against physicians who have to go outside the insurance system.
And something that's so fabulous about what you described there, and it really aligns with the work that we do as mental health clinicians, is that you are providing your patients with the tools to take control of their health and for them to have that power and control. And I think that that's huge.
I really do. And I also think about all the tools in mental health that insurance doesn't cover. That's better. Yep. That's better. And so I work so much with mental health. There's so much, I think about IFS. I think about sympathetic, parasympathetic work. I think about somatic therapy. It lights my fire because that's what really helped me. Those are topics that really have helped the patients. But a lot, at least in the United States, a lot of that is available for people who are able to and willing to self-pay for those types of services. And so for me, what's the most expensive thing? Being sick. Or having a sick child in your home, a sick family member. That is the most expensive thing. But yet people don't realize that you have to invest in your health and in your mental health to get outcomes that saves lives. And if you want to utilize only your insurance, then get results that's only subsidized and utilized by your insurance company, which is you'll get meds and you'll get, the type and the duration of therapy they deem necessary for you. This is your life. This is your family's life. So for me, myself and my clients that we work with have to think beyond what insurance companies are willing to pay and not pay for.
Okay, so I have a few questions with that. First one, is if we can ask, can I ask you what the outcome was of the insurance companies coming after you?
Yeah, we ended up settling, and I ended up. I can't go through all the details of it.
Sure.
We ended up settling, and I ended up having to shell out at great expense some money that would have put a lot of people into bankruptcy. But I stayed at the clinic for about, I would say, 2 years, 18 months after that ended, so that I could completely pay for that. And it was a very difficult time. And and it's also like getting practitioners to be able to work in that setting as well. Is some people, like some practitioners, are willing to look outside the box, willing to take some chances to deliver the type of care that our patients really need. And I know in Canada there's still stigma around doctors, medical doctors, or even naturopathic physicians, chiropractors, as if there's some alternative voodoo medicine at hand. When for me, looking at what I'm calling functional, I'm a functional medicine MD, medical doctor. So what I do is I take all my scientific medical doctor background and I combine it with everything in holistic alternative medicine that's scientifically based with outcomes, and I put it together. And we offer all the tools to people. That's what I do. So for me, I had very little fear around that. But trying to hire and keep providers that are trained and willing to practice in that became very, very difficult. And so, we had 8 practitioners. And again, I said it was, mostly family medicine, medical doctors. And then I had a bunch of naturopaths and a naturopathic medical director, and we worked together. But fairly quickly, when, the lawsuits started to happen from the insurance companies, all of them left. Because they didn't want to be left holding the bag or having like some of their work production bonuses to have to come back, whatever. All of them left, and I was left holding the bag during this entire lawsuit. And so for me, the outcome was, for me, actually, it taught me a really valuable lesson. It really taught me leave clinical medicine as quickly as possible. Get the hell out. Get the hell out, and I have nothing to do with insurance companies anymore. I don't have prior authorizations for the care that I need to save my own life or my patient's life anymore. Free myself so I can work with people who themselves are free and are ready to make those decisions, minus all that politics, bureaucracy, and honestly, bullshit.
So, one thing that COVID seems to have really done for the good and the bad is it kind of really blew open this trust the science, trust the doctors, trust the experts, right? So on the one hand, I'm glad that people are learning, oh, wait, we can't just blindly believe what someone, tells us, or that this, or that 97% of scientists say this or that, when there is funding that can, greatly influence.
Well, 5 years later, we've learned in medical school, within 10 years, 50% of what we were taught with truth would be heresy, would be the opposite.
Right. And that's the replication crisis as well that we have in the social sciences, that, a study that comes out says ABC is not replicated, yet people are still acting as if it's a settled science or a settled approach. So my question to you is, since, again, in the last couple of years, where more people are becoming their own experts, they're doing their own research, which has lots of problems because we know that there's going to be a lot of confirmation bias. There's going to be a lot of filtering out of stuff they don't want to see, right? So how has that, in your, let's say, controversial approach, because it's controversial whether it's to the industry, to your colleagues, as you say, to the community who went on the witch hunt, how has this whole post-COVID mentality and ethos kind of affected, let's say, people's perception of what you're doing?
So really interestingly, you mentioned colleagues. One of the bonuses that I had going for me was I was an extremely well-respected family medicine physician. At the time, all these health crises hit me 10 years into it. I was a referral source for tons of other specialists in my community. I was very well known, well respected. And so when I started to go into functional medicine, it was easy versus a new doc coming out and saying, I'm a functional medicine or I'm a naturopath, because look, when you have a clinic with 12,000 patients and most of it, they're coming in for their primary care as well, you're a referral, you're the money machine for the specialist's office. So interestingly, my colleagues didn't really, people who knew me and were my referral resources, they all respected the work that I did. Some of them even came and asked me to help. So for example, I had a cancer center, major cancer center said, we need help. We need help to prepare these people for chemo or during chemo with, what's going on with some of these, hormone sensitive cancers and we need your help. So I ended up collaborating with quite a few of my colleagues. When I went out of clinical practice and started my online program, supplement company, here's what happened. Sick doctors found me. sick doctors found me. So I would say that at any given time, at least 5 to 10% of the participants in our program are medical professionals who came for themselves, but also to learn. So I don't have any issue with my colleagues per se, right? If anything, they're being attracted more and more. We recently started a certification program where we actually teach about how to become MDs, chiropractors, naturopathic physicians, or nurse practitioners to become an instructor. How do you teach from one to many? Because I think that's a different skill set. So that's what we have a certification in. So when I think about the public, one of the things I think about in the last 8 years that's really changed is that when I first went online with we have to do ads because how are people supposed to find you, right? As doctors, it's not like I came out understanding what the YouTube algorithm is or the Facebook algorithm or anything. I wasn't an expert on podcasts or anything. I came out and I just started doing, videos on Facebook. It was like 30 days Facebook live challenge that my friend dared me on and I did it. And then when I went online, my program, how are people supposed to find out? We had to advertise. I had to put up Facebook ads. I learned how to do my own Facebook ads for the first 2 years. And I got so much flack on Facebook. I mean, it would make you blush and probably boil under the kind of things that were under my ads from people,
Like what?
Oh, okay. So one of the pictures I had was a sweater that I was wearing that had the shoulder bare. And then it had like a little cinch right here. So the shoulder was bare and a necklace. And it says, "Oh, you money mongering whore, drug seeking, party hopping, stupid bitch. How dare you charge people who are hopeless and helpless for your services, you druggie," or something like that. That was typical.
Oh my goodness.
I mean, the level of hatred and vitriol that people had, and it didn't matter. There were ads where I was in a lab coat and I was smiling. How dare you smile, preying on the hopeless and helpless, you whore.
Gosh.
It was bad, but this is 10 years ago. You understand? This is 10 years ago. Like doctors still had the perspective, like you weren't supposed to charge or all that. So one of the things I did was I stopped being the one to manage my ads. I stopped being the person to receive all that energy because I don't need to be and I don't want to be. And I kept doing what I did, which is besides advertising, I developed a huge content machine basically on YouTube where I just started putting content, educational content. And what I learned was that the more content I created, that was me, authentically me. No, I'm not dry. Right? I just really shared my own experience and I shared my content. The more people, the right people were being drawn. And I saw the shift change, right? And when the pandemic happened, one of the biggest shifts I saw was the movement of medical doctors online, right? Medical services online, all that. And people started to get used to the idea that online was okay. And not only online was okay, it was the only option. I was already online 3 years when the pandemic happened, where I was crazy before. All of a sudden, I'm the only medical program for these really difficult to treat diseases that were already online. All of a sudden, I became more golden. Our revenue and our enrollments tripled, right? And the interesting thing is this. Back to the original question, which was, how has the information seeking of people, the Google mania, affected this? I think in some good ways. In the good ways, in the sense that people shouldn't trust their doctors. People shouldn't trust their doctors. I don't trust my doctors. I wouldn't trust one person or a group of people as my only source for medicine, especially when the menu and their skills are limited, right? I would want to, no matter what, when you buy a car, do you just research from the car dealership or from Audi only? Do you just do your research on Audi, or do you compare Audi with, BMW and the other cars, whatever it is, right? Why? So I think that is actually a great thing, because who's leading this actual functional medicine or root cause medicine change isn't insurance, isn't medical schools, isn't doctors, it's patients. It's their demand and the thirst for knowledge that's actually fueling this. And it is honestly, and the first chapter of my book is called Leading with Curiosity. We have killed the curiosity out of doctors and the healthcare system. So who's left to have it? rogue physicians, right? Or physicians in the alternative medicine space or patients. And I found, I mean, I'll be honest, I think that their curiosity really led to asking bigger questions because I have answers and solutions for COVID and long haul and mental health that are completely out of the box, not only led by my questions, but because of theirs. So I think it's actually a good thing, but at the same time, a little knowledge is dangerous, which is why for me, I like the fact that I am an authority on many of these areas. And I will spew out endless amounts of content to say, oh, you think this, you think that? Okay, go check out this playlist on hormones and COVID, this or that. So it's been really helpful to know the space myself. But you're right, little information goes sometimes awry. And there is a population of people out there where they're dangerous to themselves and others.
So if we can shift gears a bit to mental health a little bit more, because with both of us being mental health clinicians, this is obviously a topic of great interest to us. Something that I will touch on with every single one of my clients, regardless of their diagnosis, is the gut-brain relationship and how important diet is. So you did touch on that a little bit earlier as well. So what do you think is the biggest either myth or misconception surrounding gut health and the brain?
3. I think there's 3 big misses. Number 1, boom, digestion is a big issue. And it's a core issue. It's almost like a core wound we were born with. Certain steps in our digestion is broken, and it has severe downstream effects later on in life. And a really simple concept around digestion is that it's there to break down food from bigger pieces to really, really smaller pieces. When food particles are really small, they're highly absorbable and low allergenic. Okay. So if any of those steps are broken, or there are further assaults on it later in life, or medications we used, proton pump inhibitors, let's say, to stop certain steps in digestion, we are creating an epidemic of absorption problems, as well as increasing allergy and inflammatory particles of food in our body over time. So that is the biggest miss to me, is digestion and its importance from birth to later on in life. Number 1. Second piece of gut brain is the rising problem with food allergens and the reactions that people are having to more and more and more foods that they're becoming more and more allergic to as a result of digestion is an epidemic levels. And our allergist MD colleagues are absolutely poorly equipped, if at all, to deal with it, because it doesn't involve IgE, which is emergency antibodies, which is their only tool. So we got a whole rising epidemic. And COVID, by the way, is, and I don't know how many people in your audience out there have, since post-COVID, developed lots and lots of allergic type things, including food reactions, right? That seems mysterious. And now they think they're cuckoo because their allergist and their primary care doc tells them that. Am I right? Yeah. They're not, they're right, because the infection itself infects the gut. The COVID infects the gut. And so it is further assault on digestion, further the infection in that area is actually raising the level of food allergens there. So this is a huge miss. And that's why for me, in our Transform protocol, I call it food mapping. Our food mapping system has to address both the digestion issues and, number 2, accurately be able to test what people are sensitive to that's triggering the mental health or post-COVID reactions, right? So food allergies, number 1, do not mistake it. That is a huge miss, right? And I know there was a number 3. Number 3. Your gut is not, people just think about food and digestion and allergies. Your gut is responsible for tons of hormones. The gut-brain axis, you might as well say the hormone and brain and gut axis. So for me, huge hormonal issues involved. And this is also why when you start looking at some of these new drugs that are coming out for people for weight loss, like Ozempic, some of these other things, they're really hitting on a nerve here. There's a huge hormone, gut, brain, weight, body, whole body connection that's being missed.
And so when you mentioned Ozempic, sorry, when you are you saying that that they're introducing something that they don't know that it's going to have all these unintended consequences on
no, actually, if you're talking on the case of Ozempic, they know that it's working with GLP-1, and GLP-1 peptide actually impacts several of the hormones that we already know there's a hormonal impact. It can impact on insulin sensitivity, glucagon. It actually can change hunger, our perception of hunger. We already know that some of these drugs are working with the hormonal system within the gut. And that's one of the reasons why there are so many different, interestingly, when you look at Ozempic and that class of medications, it's having an interesting impact on addictions. And people would be like, why? You're doing this gut peptide thing. Why is it helping people with sugar cravings, but not just sugar cravings? What about alcohol? What about drugs? Surprisingly, more and more people are finding there's a decrease in the cravings with those addictions. So how important is hormones in that? Huge. It's not weakness. There's a hormonal component that we're missing.
Okay. So, normally we do this at the end, but I'll ask now, so don't forget. So if you're advocating for patients to advocate for themselves, what best advice would you give to them when they are going to their family physician who's refusing to, either send them to a specialist or to do different types of, treatments and so on? How can they be their best self-advocate?
I think education, like I said, educational is the most important. And I'm not afraid of our patients going on Google and YouTube and learning. I advocate for it because there's a lot of truth tellers out there. There are a lot of truth tellers. This podcast, right, is one of them. Every listener that is listening to your podcast right now is educating themselves outside the box. So my thing is that never, ever take the one person's word as gospel, right? Never. Number one, blind faith is horrible. So education is the answer. So educate yourself on multiple resources. I'll give you an example, like listening to this podcast, go back and look at all the other episodes and see where's the other areas that I really want to grow and expand on. Look at this podcast. Who are other truth tellers, right? Who can I surround myself with that tell the truth? And that I can tell is telling the truth, because there's a lot of fake health gurus out there also, right? There is a lot of fake healthcare gurus. I will tell you something really important in the functional medicine space. The advent of like health coaches and people who claim that they know what are some root cause things, what are some medical things, and they don't have medical background. They're not medical doctors. They're not naturopathic physicians. They're not nurse practitioners. They're not, a lot of these people have, if you guys understood what how people can call themselves health coach, and sometimes the level of certification they get, and I'm even going to say this, in the US, IFM, Institute of Functional Medicine, is a great resource for medical doctors and practitioners to go learn how to train, to learn functional medicine. But then again, I'll give you an example. Learning how they're going through the hormone training is a couple days, right? It's a couple days of either online or in-person training. And there's really none unless you seek out, somehow you find somebody to mentor you, to work with you on that. So it is really scary to me, even in the functional medicine or natural medicine realm, how many people think that a functional medicine doctor or nurse practitioner or somebody knows everything there is to know, and is an area that's specializing in the area you have questions around. It's not true. It's a really large landscape. So example, if you're dealing with ADD, and you're looking for a functional medicine approach, and yet you go to your primary care doctor and just said, you need Adderall, and food really makes a difference, I would hop on Google, I would hop on YouTube and look for ADD natural approaches. And I would look through some of the content, but not necessarily even some of the most popular, but look for trusted sources. Who are the trusted sources? Who are the MDs in the space? Who are the resources? And look at the background of the person. Right? How long have they been in business? How long have they been creating content? So I want people to have a discerning eye to evaluate not just their doctor, but their sources for education, because they are very different in quality. So I'm giving people some tools. That's why my first chapter in the book is Leading with Curiosity. I actually have a list behind the first chapter. In fact, I'm going to offer every one of your listeners a free download of the book. I know you're in Canada, but if you're in the US, you could also get a free hard copy. We'll give you guys the link for that.
Thank you.
The first chapter, called Leading with the Curiosity, ends with at the end about 30 different questions you should be asking of your healthcare providers, right? And you should be asking yourself. But I would have you use the same level of discernment in looking at the content creators that you find on YouTube or Google, so that you're able to you lead with curiosity, but then also get to learn more and more with discernment.
Right. So that's two things. One, yeah, that's why I said, like, post-COVID, for example, someone who doesn't have the credentials, they could say, well, that's actually a bonus because I haven't been brainwashed by the system and everything. That's why you're saying you have to be so discerning to make sure that what they're stating truly is credible, not just their say-so.
It's horrifying. It's truly horrifying what's out there. And so if you're someone out there, and a lot of patients and doctors themselves would call themselves skeptics, right? And I think you should have a healthy level of skepticism. But if you don't have a tool to discern if the real diamond is in front of you versus a bunch of coal, right? If you don't have a tool to discern between the two, you're not a skeptic, you're just blind.
Right.
Right? Right. So I'm saying, what's the tool so you know truth from Adam, diamond from coal? If you don't have that tool, and I'm giving you the questions you should be asking to have that lens, so that will make you a smart skeptic to make scientific based decisions on truth, medical truth.
Right. So first of all, thank you so much for offering that, the download. I think it'll be an incredible, invaluable tool for people. Okay. So then, but back to my first question before, which is, okay, so they have the information. They've credibly searched everything. Now, I don't know how it would be in the States, but in Canada, I've had so many patients who are highly intelligent. Some of them are like science majors.
I love it. That's who attracts to us. That's who comes to us.
Okay, well, here's the problem. There's no us, Maggie, Dr. Maggie, in Canada, per se. I mean, there may be a few, but so they come with this information. Mm-hmm. They know what they're talking about. They've done the research, and the doctor still dismisses them, still refuses to refer them to someone, right? Because we can't self-refer. So to someone like that, what would you suggest if someone said that to you? And and again, they're not able to access Dr. Maggie. They're saying, my own physician, how do I break through that, get through to them? What would you say?
I'm actually going to say this. They can access Dr. Maggie's. Because I do think this is an interesting frontier in medicine. Because my programs are educational based, I am in education. We are global. We have served right now 17 countries around the world. And what I would say to patients in Canada, and we have a lot of people from Canada, Australia as well, UK, Portugal. We have a lot of people in different countries that reach out. There are a lot of actual online providers that are, or educational programs and mentorship and coaching that people are reaching out around the world. Don't be stuck to your geography. In this age of internet and online and YouTube and resources and learning, it's a global community. So I would say that there's so many resources, and I have a ton of patients from Canada who come and work with me, for example, in our hormone program, or who come and work with me on our digestion and food mapping program, or they work with us on our autoimmunity program or our POTS program. They come to work with us, and then they become your best clients. Regular practitioners and functional medicine natural providers love our clients after they graduate our program because they are really smart and they really do need the help and they get it, and then they come back. And one of the most important skills I teach is how they get to then afterwards assemble the team that they need. Number one, they could assemble their own Avengers. Number two is, how do they invite regular doctors into collaboration? Like I think about thyroid, and a lot of people are like, well, yeah, but I need a doctor who prescribes. And I was like, great. Here's a couple ways to ask this question with your conventional doctor that would invite collaboration that's within their scope. So I actually teach people how to talk to their doctor to get what they need. Mm-hmm. And that's a skill that's missing, right? So understand the medical online natural functional medicine community is global. More and more it's global. And number two, find somebody like me. And in the book, I actually teach it as well, is how do you invite your own doctors to collaborate? They don't have to be a Dr. Maggie to be able to provide some of the services that you need. Example, they don't have to be the supplement expert. Maybe you could be. I teach my clients the why behind every single supplement, the data they need to make that decision, the length of time when they should retest, and when they should stop that supplement or alternate that supplement. You don't need a doctor to tell you that. Why don't you learn this skill? That's a level of medical education that we have online that's available. the kind of education I provide for patients in the programs we work with is provider level. And that's why we have providers from Canada, from Australia coming in, asking us to train them as well, because it's provider level education. So that it's freed me away from the clinic, away from that, to do something educational. I have the ability to teach. And I am an educational teaching program. And yes, we work with impossible to treat diagnosis, but that's how we can do it because we're in education.
So all that said, Dr. Maggie, looking back on your own health journey, and I guess I'll say too, is I can only imagine it felt helpless, like a dead end in some situations, like you weren't going to get the help you need, because that's the experience of many of the clients that we see. What advice do you wish that someone had given you back then, or what advice would you give your past self now, given all the information and knowledge you have?
Well, I want to actually share with the audience that I had severe, debilitating anxiety, depression, ADD. And when I said I hit rock bottom, this was when I was 36 and I was diagnosed with early menopause. My mental health got so challenged that I lost my job as a medical director. I lost my job. I lost my marriage. And I nearly lost my life. And trigger warning, if anybody, I've had an attempt in my own life. And I would say that when I look back at it, it was really alone. I talk about the aspects of being the doctor and having that happen and the financial toll and all that as being an alternate holistic medicine provider. But I would say that having mystery illnesses that I couldn't understand and having mental health impact as a result of that, I don't know, that's like the greatest sadness in my life, that I didn't know that there was a different future. I didn't know at that time, even with as many tools as I had, that there were answers that were outside the box, that there wasn't only just hope, but there were already real answers out there. And there were people out there that pioneered more and more of this. I just didn't know who they were, right? I didn't know. And what I didn't know, I nearly lost my life. And I'm just so glad I didn't. So to me, the answers is just sometimes the next YouTube video away, the next book away, the next podcast away. And so I want people to realize that curiosity not just saves the cat, but it's going to save your life. Keep that curiosity alive and keep going and going and going, because the next answer is that one next video away, one next podcast away, one next question away. So keep going.
So much. So just because we did touch upon COVID, I'm just curious then, because you mentioned that COVID was affecting the gut and the hormones there. So there's so much controversy around long COVID. Is it real? Is it psychosomatic? Like, what would you say to someone?
There is no controversy. There's zero controversy that long haul COVID is real. That's the lie.
Well,
there's zero controversy that long haul exists. The question is why and what's really causing it. I saw this happen with fibromyalgia. We all saw this with fibromyalgia like 10, 20 years ago. It was like considered the fake woman illness.
Yes.
And we now know that fibromyalgia describes a lot of symptoms, but there's huge advances in it. Now we're realizing that these people can be diagnosed with multiple autoimmune disorders and some of these people have Ehlers-Danlos syndrome, genetic issues. And the chronic regional pain syndrome, right? Neuropathy, like these are all real. Right. And so for me, when I look at long haul, and I've done actually several interviews, podcast interviews around long haul, when you look at the list of symptoms of long haul, it's very similar to a diagnosis we call POTS, postural orthostatic tachycardia syndrome. And look at it. Seriously, everybody, look at the just similarities between those two, because like the severe brain fog, the fatigue, balance issues, positional changes with dizziness, nausea, right? Heart rate changes, heart irregular rhythm changes, right? Anxiety, right? Depression, right? And hot, cold tolerability issues. It's very similar to POTS. And POTS is considered a mystery illness in the medical realm in terms of people don't know exactly what the one cause is, or there's one blood test to diagnose it. So it's in that fibromyalgia limbo. So here's the thing. I solve POTS for breakfast. I solve long haul for breakfast. Why? Is because the underlying root cause of POTS, and that's what I'm actually gonna be doing a workshop in about 10 days. But the underlying, I'm just gonna give you guys a teaser here. The underlying root cause of POTS and long haul is, believe it or not, one of the mechanisms is that COVID, we already talked about, infects the gut. So that affects the gut and gut hormones. But the secret is it actually impacts all the other hormones. I see major ovarian, testicular, adrenal hormones shut down for 3 to 18 months post-COVID.
Wow.
And certain individuals are more susceptible to it than others. And I'm going to tie this together in a bow, everybody. Remember when COVID first happened, we said for some strange reason, diabetics are get it more and they die more. Do you know why?
Insulin?
Partly, yes, hormonal, right? But the other part is diabetes is actually an autoimmune disease. That's widely recognized, easily diagnosed. So we actually have an underlying existing autoimmune population and a whole hell of a lot of people who have no idea they have a predisposition. And then they get hit with COVID and then it unmasks, right? Some of these hormone problems, like autoimmune can attack your hormone making organs. So there's already an underlying wound or weakness. And then you get COVID on top of it and it shuts down hormones for 3 to 18 months. And you didn't even know you had a predisposition. So this is why some people get long haul and some people don't. It literally messes up your hormonal axis anywhere from 3 to 18 months. And 0 of the patients and clients I've worked with long haul have ever had their hormones thoroughly evaluated or understood by any of their regular or natural providers. So I'm just giving you a little taster that this is a big issue. And for me, when you look at what has happened with POTS and dysautonomia as a diagnosis, and you look at long haul, they're the same thing.
Interesting. It's like I'm going to direct one of my patients in particular to you because every question I've asked, everything you've said, and it's funny that you mentioned POTS because she has POTS and she's highly intelligent, does her own research, she's in sciences, and for years she's had nothing but let's say disregard for her symptoms, for her own research. Like she's the one who advocates so strongly for herself and she keeps getting shut down. And as she said, like, yeah, these doctors don't know about POTS.
They don't know. They're sending these people to cardiologists who are poorly trained. I have cardiologists sending their patients to me because I can fix it. They don't have any tools to fix it because it deals with blood pressure and heart rate. They send it to a cardiologist. And my cardiologist friends they want to help so badly, but there's nothing that they can do for these people. Right? It's not a cardiac problem.
Right. Yeah. But that's how it's experienced. So along with everything else. Yeah. So again, everything you're saying, like really, I'm going to be reaching out to her and letting her know she has to watch this podcast.
And there's so many too of my clients. I'm like, this person could all benefit from what Dr. Maggie is doing.
Smart people, and your audience is really smart. And so I credit to you guys for putting in podcasts like this, content creators who actually put on these long form educational content, deep, thoughtful conversations that really validate and educate all these really intelligent people out there who deserve and who need help. Right. So, I mean, kudos to you guys because this conversation has been really deep, rich. And I love that you guys smart ass people is all I'm saying. And I think your audience are smart ass people. I can't wait to, have them hear this episode. And I want to consume more of these episodes from you guys.
Thank you.
Thank you.
Yeah.
So Dr. Maggie, how can people find you online?
Sure. So number one, I want to make sure you guys, everybody gets a copy of the book. In Canada, you can download it. And then if you're in the States, you can get a free copy. We'll provide the link. My website is drmaggieyu.com. The last name is spelled Y-U. And then my YouTube, most importantly, my YouTube, it's Maggie Yu MD on YouTube. So if you look up Maggie Yu MD, my channel will come up. We currently have 41,000 subscribers. We also have an online community Facebook group on Facebook called Transform Your Health Naturally. We have 100,000 people in that Facebook community. So get into communities, get into the Facebook group, and just learn more of anything. If do nothing else, if something here sparked your interest on COVID or POTS or on, postpartum depression or menopause, go look up my name and that term and start watching some of our playlists and get yourself educated.
Amazing. And do you have any last thoughts, any last comments for our listeners?
Yeah. Somebody asked me yesterday, in one of our programs, Marissa, one of the participants in our program, says, Dr. Maggie, do you have a catchphrase? And this goes back to, I think, when I said, what is something I wish my younger self knew? My catchphrase is, of course I can. And I don't know how many times people, and I want everybody to think about adopting that, because when we were kids, we were born with this kind of level of, look at our toddler. Our toddler thinks they could do everything, right? Of course I can. I can go touch this. I can go I can go up to that dog, anything, right? And then somehow we got scared to death and we lost it. And now I would say with myself and with 99% of the individuals we work with, their catchphrase is not, of course I can. It's actually no. And I want to say, stop that shit. Stop it, right? If we can change our go-to statement to, of course I can, your entire life will change. I promise you. And you have to practice it over and over again until it feels real. Someone says, can you go to that concert? Of course I can. Can you do this by tomorrow? Of course I can. Like, just practice saying it. It takes the same effort to say, of course I can, to maybe or no. It's the absolute exact same expenditure of energy. So just choose, of course I can, and it will freaking change your life.
Amazing.
Okay. Well, again, thank you so much for coming on and, just sharing these insights. And I think it's very inspirational. And, we'll have all the links and everything in the description. And I'm sure more people will reach out to you. And yeah, we need more people like you who, again, provide a different path, open another door, give hope. I mean, in our industry, hope is such an important commodity. So I think you are providing that hope, not blind faith, not false hope, but realistic hope. And I think you really help people see that hope and see the path forward. So thank you again for coming on. And on that note, until next time, keep your eyes on the road and your hands upon the wheel.